All righty. Hello, everyone. Welcome to another episode of Open Heart Discussions. Today, we're going to be talking with Arden Yingling about her work in the field of acupuncture and some other things that she has going on at her practice, Songbird Acupuncture.
Yeah, that's right.
Yeah, so thank you so much for being here.
Thank you for having me.
Yeah, and I would love, Arden, if you would tell us first, starting out, about your qualifications and credentials, and then about your professional journey.
Sure. So I am a licensed and board certified acupuncturist and Chinese herbalist. I have a private practice, Songbird Acupuncture, as you mentioned, in Southwest Austin. And I work with women throughout the whole reproductive cycle. So that looks like starting with everything from, regulating the menstrual cycle and fertility all the way through pregnancy, postpartum, and now on into I'm working with women in midlife as well. So the hormonal changes that come with perimenopause and menopause. And I'd say the other big piece of my professional focus is also on mental and emotional health. So I do a lot of work with the emotions that come with all of these big life transitions and the big hormonal shifts that happen for women as they transition through those parts of their lives.
Awesome. Do you mind telling us more about that and what that looks like?
Yeah, about the mental and emotional piece.
Yeah, and how the acupuncture and the everything that you mentioned ties into it.
Yeah. So, as you probably know, the body and the mind are one. I mean, I practice a form of medicine, Chinese medicine, that's a really holistic whole body system. So we don't really, in my form of medicine, see mind and body as separate in any particular way. And so what I find is that women will often come to me for physical complaints. They'll come to me because something feels wrong in their body. But then as we start to talk, it will come out that there is almost always some kind of an emotional link there too. There's chronic stress, there might be anxiety, there might be depression, and it's kind of a two-way system. So it may be that the feeling bad physically is driving that emotional piece. It might be that the emotional piece is driving the physical complaints. It might be both, and we don't really know, a chicken or egg situation. But they're linked together. And I think that a lot of the women that I work with don't necessarily come in specifically for that emotional piece, but as we talk and I get to know them and I get to know what's going on with them, we realize how important that piece is too. And Chinese medicine helps all of that through just looking at the patterns of imbalance in the body, which are different for different people. It's a really individualized, unique medicine. And so we talk a lot and find out, where are those pieces of imbalance? Where does it feel like things got a little bit off kilter? And then by regulating those, all the other pieces start to fall into place. There's, for me, a big focus on nervous system regulation and just calming down the kind of chronic stress response and the hormonal pieces that come from that a lot of women find themselves in. I think that's huge for the population I work with. And I find that once I start to make some progress on helping people's nervous system shift, a lot of those other things just start to fall into place naturally.
So is there a particular area within that population, the whole reproductive population that you talked about, you feel more passionate about, or more that's really your subspecialty, or what would that be?
Well, I mean, what led me to this field originally, this was a career change for me. And so what led me to it, and my original passion in this field, was working with women during pregnancy, but most specifically postpartum. And that's because of my own experience. I'm somebody who had a difficult pregnancy. I had a baby in the NICU, and I had undiagnosed postpartum anxiety for months after my daughter was born. And it was my own experiences living with that, and also seeing the ways that I did not receive care, the help that I did not get, and the questions that I wasn't asked, and realizing kind of after the fact, like, hey, that wasn't okay. And then also realizing, hey, this happens to a lot of other women too. Like this was
Right.
nothing unique to me. That really was the catalyst for me to say, I want to help that. That's where I want to work. I want to help that population. I don't want this to be women's experience anymore. They deserve to have a space of support. And so that working with women, particularly as new moms and with difficult postpartum experiences, was my that was my why for getting into this medicine. I had a baby 17 years ago. So over time, I myself as a person have shifted into more of midlife hormone transition into perimenopause. And so that's kind of now becoming my second why, if you will, is because that's another area where there's a lot of silence, a lot of misunderstanding, a lot that's not talked about, and a lot of lack of support. So I do that now too.
Yeah, well, that really ties into my next question that I wanted to ask is, what are some topics that you feel are not discussed in the field, especially the perinatal population? Is there anything you want to speak to on the topics that should be?
I mean, I want to say that I think that it's getting better. I mean, my experience, like I said, was 17 years ago, and it was dismal. There was just not screening for perinatal emotional health, like hardly at all. And even when I took myself to the doctor, knowing that something was wrong with me, but not knowing what or why, I was told to relax, basically. That was the treatment I got. So, I mean, I think we've come a long way. I think there's a lot more discussion of this than there used to be, but there's so much more to go. So we're still not talking enough about what women's true and honest experiences are. And I think that women still feel ashamed in some cases and unsure about voicing how much of a struggle they're experiencing as they become mothers, issues with birth trauma that they feel ashamed about, like it was their fault, and definitely still really a problem in the postpartum phase of like, something's wrong with me, I'm not a good mom, why is this like this for me? And they, I still see people who don't feel like they can voice that to their family, to their friends, to their doctors or care providers. So yeah, we're not done yet with that.
You're absolutely right about that. Those such great points, things that are just often not discussed or still pretending that they're not there, and there's still stigma and shame that gets carried around it that will keep someone from talking. And thank you for sharing your story about those pieces of what you went through. Even though you keep saying like that was a while ago, that I know must have just been so hard, especially like you said, you can probably see how there's a lot more discussion around it now, but like you said, we still have a long ways to go. I just can't imagine how it must have really been even 17 years ago. Like it was probably not talked about at all.
It really wasn't. And it was really confusing because like I said, and I still think this is women's experience sometimes, I knew I wasn't okay. But the only thing that was talked about back then was postpartum depression. Right. And so I thought, well, I'm not crying all the time. I don't really feel sad. I can get out of bed and function. So I guess I don't have postpartum depression. And nobody has talked about anything else. So maybe I'm just a mess, And I still think, just based on the women that I work with, there's still a lot of lack of recognition of the other ways that mood issues show up for women at that time of life. Too many people still don't know that you can have postpartum anxiety or postpartum OCD or any of those variants.
Yeah. Absolutely. And I think what still is so scary, even in this time, is people still confuse or worry that their postpartum depression means postpartum psychosis, which is a totally separate thing. But the fear is, if I say I'm feeling this way, people are going to think that I want to hurt my baby. And
and they're going to take my baby away and put me in the hospital. And which is, you're right, they're completely different things. And there's not, it's just not being laid out really, these are discussions that women should start hearing when they're pregnant, or even before they decide to have a baby. They should know, like, hey, these are things that can happen, and it's not to scare you. It's so that if you come to that from an educated place of knowing what the possibilities are, you can get the support you need if you need it. Yeah.
Absolutely. Absolutely. So talk to me, because, you and I first met, you reached out because we both do a lot of birth trauma work.
Mm-hmm.
Wanted to know, some of the therapists that are around, and I loved knowing an acupuncturist that I could send. That's my main thing is birth trauma.
Yeah.
Why is mental health so important to this group of people? Why is the mental health awareness important?
Because I think that most people have some kind of trauma or some kind of chronic stress and or trauma, and that might be birth trauma in the populations that you and I sometimes or often work with. It might be something else for other people. It might not be birth. And again, it goes back to that piece of silence and shame in our culture. It's too often, people don't know what that looks like. They don't know how to recognize it in themselves. And so therefore they don't have the tools to manage it if it becomes a problem that's affecting their lives. We really live in a culture that encourages us to tune out and to like disconnect from our bodies and our minds and what's going on. And I practice a form of medicine that instead goes the opposite way and encourages people to be like, what's going on? Like, listen to your body, listen to your mind. What's it telling you? What are you feeling right now? And I think that ability, learning how to tap into that and recognize those signals and figure out what they're telling you is how we start to heal. We have to be able to see it and name it to be able to then move forward and heal it. And so you have to be able to accept that's a necessary part of mental health, and that even focusing on your mental health is important because it has a huge impact on your physical health and the entire rest of your life, really. So, yeah.
What, excuse me, what would you say about other mental health therapists like me? When do we, I think it's always a good time to refer to acupuncture, to add into that treatment. But when would you say is like, yes, this is a time that you really would want to reach out to someone like you or give a referral?
That's a great question. I would say two things. First of all, if you are aware as the therapist that your suspicion is that whatever that person is dealing with emotionally is affecting their body, that they've told you that they have physical complaints that you think may have a connection to that emotional piece, then that's where somebody like me could really be a helpful additional therapy. And I think also people who somaticize their emotions. So the feelings tend to go into their body. If you see that happening, that's kind of a variation of what I just said, but I see that a lot. They say, I'm not stressed, I'm fine, but my stomach always hurts. Mm-hmm. Or I have this chronic back pain that nothing I do helps. Those kinds of things are a good place for me to step in and be an additional support.
Okay. And just for some of our viewers who may not be familiar with a lot of the terms like that we would use, that somatization, can you a little bit break that down, exactly what that means?
Yeah. So really all that means to me anyway, you may have a different definition of it. To me, as not a therapist, it just means that you're feeling those feelings in your body. So to come back to that example of the stomach pain, and I choose that one on purpose because it's something that I see a lot, is that consciously a person might be like, I don't feel anxious. I don't have anxiety because I don't feel anxious. However, my stomach always hurts, and I've been to all of the stomach doctors, and there's nothing wrong with my stomach, or my entire digestive system is completely healthy. but my stomach always hurts. So that would be a kind of classic example to me of what that means. Yeah.
Yes, well said. That exactly it. That feeling that we get in our body, or we're always like not always sure what anxiety can mean, what depression can mean, but it's that, you know, feeling in our body. I'm always on nerves. My stomach always feels like it's in butterflies, or it's
Yeah.
hurting, or I'm noticing these pains other places in my body.
Yeah.
So something important to look into. And you know, I think as therapists too, there's a lot of people who agree with you that there's this mind-body connection, that we've got to take it more from just here and really go to the body and see what's there, because trauma can be stored in the body.
Yeah.
Stress
Exactly.
is. So, you know, thank you for explaining that for
Yeah.
do you do any work with fertility?
I do. Yeah.
Awesome. Can you tell us a little bit more about that? That is, you know, something that I see a lot, and people asking for referrals, and how acupuncture could help benefit that.
Yeah. So acupuncture, I think, helps in two main ways with fertility. First of all, just on the purely physical level, there's a lot of research that shows that acupuncture treatment can help improve the uterine lining. It can improve egg quality by increasing kind of microcirculation in that part of the body, in the pelvis. And so you end up with a much more successful setup for pregnancy. It can also help balance hormones. So if fertility issues are coming from a place where there's some hormone imbalance, it can help there too. So that, you know, on the physical piece, there is actually quite a lot of research on acupuncture for fertility showing that it really can improve outcomes in those ways. But I also, like, every fertility patient I see is stressed out and anxious, right? Like, that's just it's difficult. It's a hard place to be. And of course, that doesn't help the matter anyway, because if we're always stressed all the time and anxious and worried about getting pregnant, then that can sometimes have a negative effect on the hormonal balance and kind of throw your menstrual cycle off. And then the whole journey becomes even harder. So I definitely always work with the stress and emotional piece for all of my fertility patients. And I think that's a big piece of the treatment. Just a place to be, another place to be heard, just a place to talk about what they're experiencing. Yeah.
Part of this project, and I want, is for people to be aware of resources and you know, other types of things they can use in addition to mental health counseling. And the resources are very important too for the BIPOC community and community. Can you talk to me about just your experience with that, with acupuncture? Is this an appropriate thing that would, you know, that could be helpful as well to, say, someone who feels like they've been discriminated against or haven't had luck in some of the other traditional or Western traditional type of
absolutely. I mean, unfortunately, it's true that there's a lot of systemic racism and there's a lot of discrimination against those populations in, you know, in all forms of medicine, but certainly in the more traditional medical field. You know, people of color and the LGBTQ community can feel like they've been minimized, brushed aside, not listened to, when the reality is that, you know, there are different health outcomes for some of those populations. You know, women of color are at risk in different ways for different kinds of gynecological conditions, for one thing. And that, if that's been minimized when you've gone to see a healthcare provider, not only are you not getting the physical care that you need, but once again, we introduce that element of trauma there, that you haven't been heard and that you don't feel safe. So I certainly hope that my work can be helpful to people in those situations, because what I do is very personalized. It's not a generic form of medicine. So I'm always looking at that individual and what their reality is, to figure out the best way to treat them, and looking at their body as a whole. And I hope that I can be a safe space to populations that are needing that safe space. It's something that I'm continuing to work on. You know, we all have our unconscious biases, and I am no exception. But that's something that I'm really consciously working on, being as informed as I can be around those issues, so that I can be of help to those populations.
And that's it. That's the key, is like you said, working on. It's a continuum work.
Yeah.
Starting somewhere and continuing. It's never ending.
Yeah.
Something I talk about a lot. So thank you for addressing that. Is there anything, based on our conversation that we've had so far, that you would want other professionals in your field to know? Like if you had something to say or a message, what would that be?
My message to other practitioners in my field would be to just, if you work with mothers or people kind of in that field, make sure you ask how they are really doing beyond whatever physical complaint they might have come in for. Even if they come in for knee pain, ask how they're doing really, and ask if they have enough of a support system, because that won't always get brought up, but it is worth asking about.
Mm-hmm. Yeah, no, that's great advice. What would you want the public or your clients or potential clients to know?
I thought about the answer to this question, and I think my answer is that I would tell everybody, whether or not they're my potential clients right now, that whatever you're going through is okay. I have a lot of people come to me and apologize and say, there's so much wrong with me and I'm such a mess. I'm sorry, I'm such a mess. And so I kind of want to say to anybody who might be watching this, whether or not you're interested in coming to an acupuncturist, that you're not a mess, and it's okay. You don't have to apologize, and that all of us are worthy of needing support and needing care, whatever that might look like, and whoever you end up getting that from. It's okay. So
awesome.
I think we all need that right now. So
yeah. Oh, absolutely. And what a great message for people to hear, that just knowing in this time, it just feels so isolating for so many people, to know that there's help out there in the form. I mean, there's just lots of different things that you can get help for. And I'm so happy to know that there are resources like, what we call alternative therapy medicines, and to use either on its own or as an adjunct to mental health therapy with a licensed therapist, mental health professional. So I wanted to know if you have any resources that you would recommend, that you want to point people to, and then also follow that up with you being a huge resource. How do people get in contact with you to learn about?
I mean, I think we're lucky here in Austin for local people that we have so many amazing resources around, perinatal and postpartum support. I really love the Pregnancy and Postpartum Health Alliance of Texas. They're often one of my first go-tos when I know that a mom or a new mom needs support and I'm not sure what. It's a great support source and kind of clearinghouse of other practitioners and other information. So I often use that myself or direct people there. And I would say, in terms of other resources, if anybody is watching this and curious about working with an acupuncturist, I would just like to put out there that make sure that you're working with somebody who's licensed, either in Texas, if it's Texas, or in whatever state you happen to be in, that they have a master's level education and licensure from the state. And that just means that you're going to be getting the safest and most effective care possible. So I wanted to put in a little plug for good education there. And as far as so all of my contact information is on my website, which is songbirdacupuncture.com. That has my email, phone number, all the ways to reach me. I offer a free discovery call to people so that we can just talk on the phone and just find out what's going on and see if it's a good fit. Not every practitioner is right for every person. So I like to make sure that I'm working with people where we feel like it's a good fit. I'm also just recently starting to offer one-on-one online health consultations, and those are available to people who are not necessarily in Austin, but are interested in these kinds of services. And so obviously I can't do acupuncture online.
Right.
Yeah, but what I do offer is a personalized acupressure protocol, and I teach people how to do that.
Awesome.
Yeah, it's really great. People actually really love it and have been getting great results from it. So it's pretty cool to see. And I also offer herbal and supplement recommendations if that's appropriate, and any lifestyle changes that I think might benefit. And basically it's everything that I do in my private practice here in the office without actual needles and online. So that's my other new offering. And all of that there's more information on my website, and all of my services can also be booked online. So.
Okay, great. Do you have any social media that you want to throw out there for anyone to follow?
Yeah, I am Songbird Acupuncture on Facebook and on Instagram.
Awesome. Awesome.
Yeah.
Oh, well, is there anything else that you want to cover that maybe we haven't yet, or any other final thoughts that you'd like to throw out there?
I think no. I mean, I think that my overarching message is the one that I think I've already probably said more than once in this talk that we've had, is just that it's okay to need support, and that there should not be any shame in struggling or in having a hard time, whatever stage of kind of reproductive life you're in, or whatever stage of life in general that you're in. And that I do encourage people to seek out some form of support, whether it be from somebody like me or somebody else, that there is plenty of help out there. And so yeah, go find some. Yeah.
Great. Well, thank you so much for your insight today, for your messages. You brought up a lot of good points, and I'm happy that we got to discuss that and put this video out there for anyone who just may have questions or just comes across it. And if that inspires even just a few people to say, you know what, that is good. I've been feeling alone, and I know that there's help out there. Then that's my message, I think,
Yeah.
I want to get through this project. So thank you again for
thank you
coming on today. So,
yeah,
you have a great weekend.
you too.
Thanks. Bye-bye.